In fact, of course, I work for Diana. She has to vote for me, you know. So she's my boss, just as you're her boss. And I am so very pleased to be here. Dr. Cabal, we've heard a lot about Denver Health from Diana. I want you to know that. And it's all been very positive, and she has held you up as an example of what needs to be done throughout the country. So congratulations to you for your leadership. Dr. Milankovich, thank you for your leadership in the community health. We will not get to where we want to get without a robust, expanded, and as you know, we've invested additional substantial dollars in the community health centers of America so that we can have what Teddy Roosevelt said we ought to have. Now, he didn't say it exactly this way, but because this is our mantra that we needed to make sure that every American had access to affordable quality care, or as you say, level 1 care for all. Same meaning. And Doctor, I very much appreciate your welcoming America to the rest of the industrialized world, and indeed the rest of the world, very frankly. President Obama and John McCain had a debate in October. In that debate, the subject, as we all know, was on the mind of many, was health care. And both President Obama and Senator McCain, he was not then president, both senators said we need to reform health care in America. We need to have a system that gives access to all Americans. The president, when he said that, meant it. And the president has led on health care. But I want you to know that one of the critical members in the Congress of the United States to get this bill done was your own Diana DeGette. Diana DeGette, who of course served in your state legislature with great distinction, elected to the Congress in 1996, came to the Congress and shortly thereafter was perceived in a very short period of time as a real leader. And as a real leader of conviction, of intellect, and real focus on health in particular. The health of all people, the health of children, the health of women, the health of families, the health of males, the health of all. And she was on the Energy and Commerce Committee, which was the principal player. Now, there were 3 committees that were engaged in this debate in the House of Representatives, 3 committees that worked together, but the Energy and Commerce Committee was probably the most sought-after committee in the Congress. Now, it's not the best committee. The Appropriations Committee was...
It's not true.
What's that?
Energy and Commerce is the best.
That's what I said. Oh, no. It's the most sought after. She agreed with that. But then when I went to say that the Appropriations Committee is the best, she emphatically disagreed. But I served on the Appropriations Committee for 23 years, and it all depends upon perspective, I've found in life. So we have a slight disagreement. But having said that, the broadest jurisdiction of any committee in the Congress of the United States is the Energy and Commerce Committee. And as a result, we are very, very careful with the members. You have to be elected to these committees by your colleagues. We are very careful of the members who are recommended for and elected to the Energy and Commerce. They have to be, as I said, Diana is, high intellect, extraordinarily complex issues with which they deal, highly motivated, focused, and have the kinds of values that reflect the best of America. Indeed, the best of Colorado, the best of Denver. And Diana DeGette has that. Not only is she a member of this very, very important committee, but as she heard, as you heard, and I'm not sure you understood, she's a Chief Deputy Whip. There are only 8 Chief Deputy Whips in the Congress. So that means she's at the upper level of leadership in the House of Representatives. And I've worked very closely with her almost all the days that she's been in the Congress of the United States. Teddy Roosevelt, through Barack Obama. And almost every president, not everyone, but almost every president, I quoted Nixon, Bush 1, other Republican presidents, Democratic presidents, have all said, in the richest country on the face of the earth, we need to have a mechanism to make sure that every American has access to affordable quality health care. not have to wake up as a family in the middle of the night with a child with a fever of 103 or 4 or 5 and have the only access point, the emergency room of our hospitals. Or have a temperature, have an earache that if they had a primary care physician or somebody to advise them, they could simply take care of themselves. In Prince George's County, Maryland, one of the counties that I represent, we had a young man, his name was DeMonte Driver. He was 12 years of age. He had a toothache. His mom couldn't find a dentist. Now there probably was a dentist available somewhere if she'd known how to find the dentist. But she didn't know how to find the dentist, and that tooth abscessed. That child went to the emergency room. 30 days later, that child died at the age of 12 because of a toothache. It cost $250,000, but much more importantly, it cost the life of a young child who had great promise because of the lack of a probably $75 or $150 visit to a dentist. That shouldn't happen in America. And what President Obama and the Congress of the United States said was, we're going to enact legislation which will try to make it clear that that will not happen in America, number one. Number two, we had spiraling costs, not just for individuals and families, which was critical, not just for businesses, which was also critical, but for the government as well, which all of us pay for. Medicaid, Medicare, costs rising rapidly. For businesses, we were becoming uncompetitive, non-competitive in the international marketplace because so many of the businesses with whom we compete around the world in this struggling economy do not have health care costs because they're centralized. And so many businesses had to drop their insurance. I represent 60,000 federal employees. There was a study done in 1986 by the Hudson Institute that compared private sector health insurance with public sector health insurance. It was substantially, private sector, substantially better than the government health care that was offered to the government employees. That is no longer the case. It's not the case that the federal insurance got better. It is that the private insurance had to keep cutting. Options, where they were mostly non-contributory, they're now contributory, and HMOs may be the only available option for employees. And if you look at healthcare contributions by corporations now are down about a point, and contribution by employees is